Hello guys, so next topic is all about comfort of the patient. So what you notice in this picture? So we have the first picture and the second picture, third picture. So what do you notice about all of these pictures? So most of them have facial grimace. Most of them are not comfortable. Most of them are in pain. So how we will make these faces change in our nursing intervention? So we will make them comfortable and we will learn how to make patients comfortable in this lesson. So let's go. So first, let us define what is comfort. Comfort, it is a state of physical ease and freedom from pain or constraint. So you will be free from pain or constraint. Most of the patients, especially those patients with cancer, those patients with terminal illness, that they are always in pain. And most of them are irritated. Most of them are not happy. Most of them are don't want to take visitors because they want to be alone, they want to rest, and they want to interfere with someone because they have pain and they are not comfortable. So in the person's unit, we need to make sure these things to to ensure that your patient will be comfortable. So the rooms, if the patient is, if the room is a semi-private room, they should only have 1 to 4 persons. Okay, more than this, it will make the person feel crowded. They make feel the person or patients uh, disturbed because of uh, lots of patients. Rooms have a direct access to an exit corridor. Okay, you need to orient the patient where is the exit corridor, especially if there's a fire or any natural calamities. Rooms are designed or equipped for full visual privacy. Okay, if the person is semi-private, at least there will be a curtain. Rooms have at least one window to the outside. Okay, this is a way to view the outside world so the patient will not feel stressed because she or he is only confined in one room. Each person has a closet space. Okay, it means that there is a cabinet uh, for one patient, so or shelves, so she can put her personal things. Rooms and bathrooms and bathing areas have a functional call system. As I've told you, it's not only the call bell with it's not only the beds with call bell. Also, there is call bell in the bathrooms. Person has a bed of the proper height and size. If the person is obese, the bed should be bariatric bed. Okay, if the person is a normal patient, the patient should have a normal bed. A person has a clean, comfortable mattress. Bed and bath linens are clean and in good condition. Bed linens are appropriate to the weather and climate. Okay, if you see the patient is sweating too much, don't put on blanket. Make sure that you follow what is appropriate with the temperature of the room. The room has a furniture for clothing, personal items, and a chair for visitors. Why chair for visitors? Visitor plays an important part in the recovery of the patients because it supports the emotional aspect of patients. Rooms are clean and orderly. Room temperature levels are between 21 to 7 degrees Celsius. That's why if there will be problem in with the air condition or the temperature of the room, you need to report it immediately with the engineering so the patient will be comfortable. Ventilation, humidity, and odor levels are acceptable. Okay, some patients, they are passing urine, passing stool that can cause the room to smell bad. So you need to call them the cleaner uh, to spray and to remove that smell. Non-smoking areas are identified because we cannot prevent patients who are smoking. Okay, they need to smoke. So we should tell them where is the designated areas for smoking, not inside the hospital. Sound levels are comfortable. Lighting is adequate and comfortable with little glare. Rooms have clean, orderly drawers and shelves. Room is free of pests and rodents. In the hospital, we have one staff uh, assigned for pests and rodents. They are roaming around all over the hospital to remove the pests and rodents. Handrails are in good repair. Okay, any malfunctioning handrails, it should be reported to the technician or the engineering department so they can fix it immediately. Floors are clean and dry. The person setting is free of clutter to prevent fall. Personal supplies and items are labeled and stored appropriately, so it will not be interchanged with the other patients. Then these other patients will claim that this is my personal item. So you should label it. Items are within reach for use in the bed or bathroom. There's space for wheelchair or walkers, and the person has a raised toilet seats. The room furniture and equipment, okay, includes the following. There will be a bed. There will be a bed. Permit body positioning that is not visible in a regular home bed. If you notice, the hospital bed is different from our bed in our house because you can elevate the head, you can elevate the foot, you can elevate the height or make it down. So it should be one of the room furniture that the patient is having. There are four categories of hospital beds. We have the manual fixed bed. We have the manual variable height bed, semi-electric, and total electric. Okay, so what are the difference among of all of this? Manual fixed height, there's no height adjustment. Okay, if you remember the last bed that we used last Friday, that is called manual fixed height. Okay, you cannot adjust the height, but you can manipulate the height to elevate the head and elevate the feet part. Manual variable height, okay, you can manipulate both the head, the feet, and the height of the bed. If it's semi-electric, the head and the foot elevations is controlled by electric, but the height adjustment is manual. Okay, that is semi-electric. While total bed, all of the function will be electric. Heavy duty, it is for bariatric patient or obese patients, which is more than 350 pounds or approximately 150 kilograms. So we have also other hospital bed accessories like trapeze bar. So trapeze bar, it is like a rectangular shape uh, bar which is used for medical condition to use in changing their positions. So this is the trapeze bar. We have also the heavy duty trapeze equipment. Okay, this is heavy duty trapeze equipment is for the obese patients. Then side rails or safe enclosures, this will prevent the patient from falling. And inner spring mattress or foam rubber mattress, this is the one. We have hospital beds with built-in scales. It means that there is a weighing scale in that bed and it will cost a lot. So this is usually for patients who needs to monitor the weight every day, like chronic kidney disease patients or those patients who have problem with their fluid and electrolytes. Next, the patient should have an overbed table. So this is the overbed table on your left. You need to have a bedside stand on the middle and a visitor chair. Privacy curtain also is very important, and the call system. Call system should be put on the strong side of the patient. You should answer the call light promptly as the patient calls you, and answer also the call light in the bathroom or shower or tub. So, if you will make your patient comfortable from the facial grimace and discomfort face or uh, uh, painful situation, the patient will just smile on you, and you know that it will be very, uh, it is an extraordinary thing if your patient became satisfied and happy in your care. So she or he will be like this. Next is pain. So let's discuss pain. Comfort, sleep, and rest. So comfort, sleep, and rest. So I told you about comfort already. Rest is to be calm or ease and relax with no anxiety or stress. A state of unconsciousness, the sleep, reduced voluntary muscle activity, and lowered metabolism. So what are the effects of lack of sleep and rest? First, it will worsen your pain. It will increase risk of illness and lengthen healing process. Excuse me. Emotional and behavioral problems. You notice yourself if you lack sleep, okay, you are always easily irritated. Then decreased cognition, fatigue, and decreased physical activities. So we have different stages of sleep. We have stage 1, the lightest sleep level. We have the stage 2 non-REM or non-rapid eye movement. You have the stage 3 and the stage 4. Lastly, the REM or the rapid eye movement. So what are the factors affecting sleep? You have the illness. If you have cancer, if you have always in pain, so how you will sleep? If you have if you are malnourished or not eating enough, okay, how you will sleep? If you are not exercising enough, studies uh study told that physical activity, okay, uh can induce sleep. So if you have this difficulty in sleeping, you can have physical exercise during the morning so you can sleep at the night. Then environment. If your environment is, of course, noisy, how can you sleep? Drugs and other substances. If you're drinking too much caffeinated products, how you will sleep? If you're taking drugs or medications which contains or induce sleep like anti-allergy, okay, so it will affect your sleep also. Then lifestyle changes. If you are always in the bed, you're not doing anything, have sedentary lifestyle, it will affect also your sleep. And if you have emotional problems, if you are stressed with your work, with your family, of course, it will affect your sleep. So we have different sleep disorders. We have the insomnia. Okay, most of the one we know is having this condition. It is a chronic condition in which the person cannot sleep or stay asleep all night. While sleep deprivation, it is the amount and quality of sleep are decreased. The patient can sleep, but it is only decreased. Sleepwalking, okay? If you know someone who is doing sleepwalking, the person is asleep, but they are walking without knowing it. Then sleep apnea, it is very dangerous, especially for those patients who are fat or obese, okay? Because what happened to the muscles in their throat, okay, it is decreasing in the diameter. That's why if you will check on their oxygen saturation, it is low. Okay, so sleep apnea, it is a disorder that causes the person to stop breathing for a moment because of the muscles on their throat. Okay, usually it happens during sleep. That's why they are calling it as sleep apnea. So what is our role as nursing assistant in promoting sleep? Okay, so first we need to encourage increase in physical activity. Any physical activity in the morning will be helpful for the patient to sleep at night. Limit time for naps during the day. Avoid giving the person beverages or any substances which contains caffeine. So what are those products? Coffee, tea, and cola. Promote relaxation by giving the person a warm bath in the evening or providing massage. Assist the person with basic hygiene and elimination just before bedtime. So he or she will not be disturbed if there will be a call of nature. Create a comfortable environment for sleeping. Make sure that the bed is properly uh, the bed is properly tight, the bed is without uh, wrinkles, so the patient is comfortable. Position the person carefully using good body alignment. Okay, we have different positioning, basic positioning that I've told you, so you can position the patient in whatever position appropriate for him. Then turn off the television set or radio unless the person watches television or listens to the radio to relax before bed, and be observant. Okay? Pain. You know that pain is considered the fifth vital sign. So the first is temperature, second is respiratory rate, third is pulse rate, and fourth is blood pressure. So they are considering pain as the fifth vital signs because they regard as the pain. It If you notice that if the patient is with pain, vital signs will also be affected. You will be seeing that the blood pressure, respiratory rate, and pulse rate is increased if the patient is having pain. So what you will do, you need to decrease the pain so the vital signs will decrease as well. So pain is to ache, hurt, or be sore or discomfort. So pain threshold, it is a point at which the person becomes aware of pain. Pain tolerance, it is a level of pain that a person can endure uh, before taking action to seek relief. Some patients, they have very low pain tolerance. Some patients have very high pain tolerance. As Filipinos, we have very high pain tolerance. Some nationalities, they have very, very less or low pain tolerance. So sometimes it depends upon the culture. So we have different types of pain. We have the acute pain. Acute means it's sudden. It is lasts for a short time. While on the other way around, chronic pain or persistent pain, it is long lasting. It is continuous. It is long time. So usually chronic pain are cancer pain, those with chronic conditions. So those are types of pain. We have also radiating pain. So if you have pain on your head, okay, it can radiate on your eyes, it can radiate to your face. So it means it is radiating pain. Okay. So you will feel the pain on the nearby areas. Phantom pain is felt in the body part that is no longer there. So for example, if you have amputated foot, okay, your foot is already cut or amputated, but you still feel that there is pain on that area. That is called phantom pain. So factors affecting pain, you have the past experience, the personal and family duties, the value or meaning of pain, support from others, and culture. Signs and symptoms of pain, we have the onset and duration. If we're talking about onset, when when did the pain started? If we're calling it duration, how long it lasted? If we're talking about intensity, is it moderate, mild, or severe? Description is the pain is aching, crushing, okay, stabbing. Factors causing pain, what the patient did before the pain occurs. Then factors affecting pain, we have vital signs and other symptoms. Okay, some patients, if they have pain, they will have this other symptoms like dizziness, nausea, vomiting, weakness, numbness or tingling, or others. So guys, we have different pain assessment tools which is appropriate for different ages. Okay, so like numeric rating scale, or they are calling it in the hospital as NRS. It is a unidimensional measure of pain intensity for adults. Adults which is conscious. The adults which is the one who is responding. Okay? So you just ask the patient from 0 to 10, 0 being no pain and 10 being the worst pain, uh, uh, and 10 being the worst pain, what is your pain level? Okay, that is how you will use the numeric rating scale. While Wong Baker Faces Rating Scale, if you notice that there is uh, a picture of faces. Okay, this is created for children. Okay, uh to identify the level of their pain. They just point out the faces that their pain level is. So happy, and then it is changing into other level. So that is Wong Baker's faces rating scale for people or ages 3 and older. If we're talking about Flack, this is for patients who is 2 months and 7 years of age. You have the face, legs, activity, cry, and consolability. So there is a scoring. For example, if you're talking about the face, 0 or the low score, the lowest score for face, if there is no particular expression, then score 1, occasional grimace or frowning withdrawn, and the highest score, frequent constant quiver, chin, clenched jaw. So this is how we will score in the Flack. Nonverbal, this is for patients who is adult who is not speaking, like patients who is intubated with intubation and patients who is demented. We have also visual analog scale. The scale is a bar that includes words, color, numbers, or combination of the three. So 0, if you notice the color, no pain, the blue one, and then going to the excruciating pain. So what are the treatments for pain? So most of our patients, or most patients that you will encounter in the hospitals, are experiencing pain. So what will you do? First is pain medications, or we are calling it as analgesics, like paracetamol, ibuprofen. So usually, if you're in the hospital, the nurses are the one giving this. But if you are a private nurse, you can give analgesics. Then physical therapy, exercise, ultrasound therapy, transcutaneous electrical nerve stimulation, heat and cold applications. Okay, so exercise, if you have a lot of physical exercise in the morning, it can help. How? Because your blood circulation will be, you you will promote a good blood circulation, so it will decrease the pain. Then ultrasound therapy, you have TENS, it's like an electricity you're putting on a part of the body to stimulate the nerve. Then heat and cold applications. So if we're telling about heat and cold applications, usually heat or warm, it is usually the effect is to dilate the veins. Okay, dilate the veins to give more blood supply to the area. If we want to put cold applications, C for constrict. So cold applications is, it will constrict the vein. So it will lessen the blood supply in the area. Usually, cold applications, it is put for those patients with swelling. Like, for example, you have fractures, you had sprain. So you are putting cold applications on the top of your foot. Heat applications, it is applied for patients like uh, ano ba nilagyan to? Having in problems in the back. Okay, so back problems. So you have you want the good blood circulation on that part to decrease the pain. If you have dysmenorrhea, you're putting heat compress because you want to decrease the pain. You want to promote more blood circulation on that part. Distraction. Distraction means to change the person's center of attention. Okay, so the focus of the person is the pain. So you need to divert the attention of the patient into more meaningful ones. Like uh, I saw one patient looking at one page of uh, magazine. Okay, it's just looking on one page of the magazine, and after how many minutes, according to him, the pain is lessened. Relaxation techniques means to be free from mental and physical stress. So what are those relaxation techniques? You tell your patient to do deep breathing exercise or uh, pursed lip breathing. So how you will do that? You inhale with your nose and then exhale with your mouth. So in that way, that is one way of relaxation exercise. And lastly, you have guided imagery, creating a focus on an image. So same with the distraction. Same with the distraction. So what is our role in managing pain? First is help the person to relax. Next is provide distractions from the pain. Pay attention to positioning, okay? Especially for those patients who is with severe pain, make sure that you touch the patient gently because they will be irritated if you will just position them without gentle. Then massage may help to relieve discomfort, and take things slowly and be extremely gentle when you are assisting a person in pain to move. So this ends our discussion in in pain, comfort, and safety. So please expect your final exam in module 2. Please prepare for this. And thank you guys.